When was I diagnosed with what? Let's see if I can vaguely remember the approximates. When I was in my early 20s, I kept losing weight, and um, I was nothing. I was like pounding down ice, anything to try and gain weight, and I couldn't do it. And I knew it was abnormal and it was wrong. I was also choking on most everything I was eating. I always had to, which I'm back to, which is why I know I need my throat stretched. Um, Drinking liquids was everything because I was constantly choking. But I know enough about medical, and I had already been dismissed enough to know that um, choking on things is like a neurological symptom and a rare neurological symptom. And I didn't want to be dismissed or thought and told I was crazy yet again because of my psych history and stuff, and because my symptoms are so weird and diverse that, sorry, I keep flashing the toilet, it won't stay on the holder, um, that I didn't want to bring it up. And finally, after winding up in the psych ward for my first psychotic episode, no, that was my second. My first one was right after college. The very end, when I was supposed to be graduating, I was in a hospital experiencing my first manic psychotic episode. So I had started to have another episode, and instead of being forcibly inpatient, I had inpatiented myself because I had been down this road before, and I could tell the symptoms were coming, and I decided to get in front of them while I still had the insight to do so. If you are experiencing psychotic episodes or have a known psychotic illness, there is a period of time where you have insight uh, before you lose it, and you are aware of your psychotic symptoms um, returning before you lose insight, awareness that they are symptoms. You need to bring it up to your team, or you need to check yourself in somewhere. So we'll step back a little bit. When I was about to graduate with my bachelor's degree, I had my first major psychotic break. Um, that was back in 2006. Um, when I was in the track team in high school, um, after running practices, my lips turned blue. My heart rate skyrocketed, and 45 minutes later, it was still abnormal, and I was still discolored. Um, but they decided to just sit with me and not call the ambulance. But I was told a letter was sent home to my parents that until I got my heart checked out, I could no longer participate in sports or anything like that. And they, being my parents, never followed up with anything with that. So I was having cardiac issues, capacity to breathe and move issues well into my adolescence. I was also having tremors in my adolescence. I had the symptoms that they put off to eventually basilar artery migraine without um, headache, uh, which I now believe have to do with the fact I have chronic microbleeds and the two AVMs in my brain. Um, in my adolescence, um, but it was never looked into. And so I was at the psych ward after trying to convince my doctors that something was wrong, and no one would send me anywhere to get checked out. They just said I was because I had a history of an eating disorder, and I thought I wasn't eating enough. I even kept track of everything I ate. I was eating 3,000 or 4,000 calories a day and was losing weight. And I brought a journal, and I brought my partner for evidence, and they still wouldn't believe me. So while I was in the institution, I kept going to the counter for Miralax and stuff because my food would spontaneously come up. Um, and I was having so many issues there eating that they called my primary, and they said I needed something checked out. There was something abnormal. And that is when they found my precancerous polyp. I was about 27. No, I was 27 when I met my partner, so this would have been 22 maybe. I had a large polyp. It takes a long time for a colon polyp to become cancerous. And it was already at the point where the extended tip of it was becoming cancerous, but it had not extended past the tip, like my finger's glove here. So they popped my polyp out. And after that, I had 1 year, 1 year, 2 year, 2 year. I'm now at my 5 year. When I passed my 5 year, there's issues getting back in touch with my gastro. So now I'm getting an intermediary look and attention from the specialists. But I have to go back to my normal gastro and follow up with their findings. But thankfully, they're at least letting me get my procedure, because that's like, this is my first 5 years out. And I don't know what's going on down there. They extend it out each time they find non-precancerous polyps. I always have polyps when they do the colonoscopy, but so far they have been sessile, and even the, I forget what they're called, but the polyps that stick out like this are more likely to become cancer. The flat ones are fine. They have been fine, so that's why they extended me out, but I'm still, for the rest of my life, every 5 years, because it takes about 10 for it to become cancer. Every 5 years I have to have a colonoscopy and polyectomy, where they take all the polyps they find out and send them to the lab and make sure there's nothing going on. So that was the first thing, and they also found out that I had H. pylori in my stomach lining, and so I had to go on antibiotics and all that. That's the very common parasitic infection that's very hard to kill, because it lives in your stomach lining, and you have to dose it with very heavy antibiotics because it's protected by your stomach acid, but it causes ulcers. So I'm glad that they found that. And they found that my throat was like narrowed to just a tiny little hole. So that symptom that I never brought up for fear of knowing exactly how people would react to it was very, very real. And I had undiagnosed esophageal reflux for years, to the point where my throat had developed a ring of scar tissue. They call it a stricture. And the narrowing of my throat, there was only like a pupil size for me to swallow through. And so between all of those things, that's why I was losing weight. And they finally got it looked at, so I got diagnosed with that. And I'm the 30th of this month, I'm going to have my 5-year colonoscopy check to make sure I don't have anything new cancerous growing in there. And to restretch my throat, they told me that I would need it periodically throughout my life. And it has been about 8 or 9 years since I had it done. And I can tell, because I'm choking on everything again, even soft foods, that I have another throat stricture. I'm looking forward to the capacity to just swallow things without choking on them, and not pay attention to whether I'm eating something stringy like celery, because I might choke to death. So that'll be good. And so that's where the colon cancer, precancer problem came from, and why I get colonoscopies at such a young age. Sometime in there, they also found I have very fibrous, dense breasts, and I had a couple fibroadenomas, and so now they keep track of my chest as well with mammography, because I grow so many abnormal lumps. So far, they've all been benign, but because of the type of tissue that my breasts are made out of, and my capacity to grow cancerous tumors, they regularly check my breasts. I'm long overdue for mammography, but I put it off because of all of the rest of this stuff. I was diagnosed with my sleep disorder in 2015. I started falling asleep at work. It was getting so bad that if I stopped moving, I would fall asleep. If I sat down, I would definitely fall asleep. I'd find myself asleep on the toilet at work. I would, if I stopped to take a break, I would fall sometimes I would be so sleepy that, and this was before ME/CFS, I'd be so sleepy that I would be dusting a hallway and I would fall asleep against the hall, standing upright. And so this clearly started to interfere with my job. And I was like, there's something going on. This is not, I'm not choosing this, it's happening to me. So I went to get it checked out as not to lose my job. And turned out that I had, they did all the sleep testing, the sleep study at a sleep center, and I was diagnosed with idiopathic hypersomnia about 2015. Also, somewhere in there at about 2011, I was turning pale and collapsing, spontaneously just fainting. I couldn't walk more than a few inches without my heart racing. My heart rate was all over the place. It dropped as low as like 30 beats per minute, which scared me. That's bradycardia. That's when your heart goes too slow. And skyrocket up to like 200 beats per minute when I was just sitting still and doing nothing. I had all sorts of symptoms. My hands were always black, not just purple, but black. I couldn't get in hot water. All the numerous symptoms, and the heart doctor dismissed me as anxiety so many times. The hospital began to dismiss me. I stopped going to the hospital. The only time I wound up in the hospital was when someone else would find me faint somewhere, and then they would call the ambulance, and I'd wake up in a hospital. I'd be like, great, every time I come here, everything is normal. They ended up finding supraventricular tachycardia, SVT, and they did a tilt table on me. They diagnosed me with POTS. I had a positive negative. I had verifiable reactions, especially when they put in the adrenaline hormone, documentable symptoms of blood pressure and heart rate going all over the place, meeting the criteria for POTS, but I didn't faint. So I had a positive negative, and he said, I don't know what to make of you, but I believe you now. I was like, well, fine a fucking Lee, because he was a real jerk. And he diagnosed me with POTS, postural orthostatic tachycardia syndrome. That was about 2011. And I was on propranolol, no, some heart medication, and did all the lifestyle changes and everything, and it helped a lot for POTS. He said he didn't want to look any further. They were going to ablate my heart because they thought that would be better before they did the tilt table test. I'm glad I didn't let them do it. I walked out against medical advice, MA or whatever it's called, from the hospital when they wanted to do that. And then a handful of years later, my partner and I went out for dollar clams and shots, and it was a date, and I got horrific food poisoning. I could not stop, so we ended up taking me to an urgent care, sent me to the ER, and they did a chest scan, and that chest scan happened to catch a big nodule. They didn't know what it was, so we went for more detailed scanning in my lungs and found out that I had a massive aneurysm that was shunting blood. It comes off the direct artery off of my my heart directly. You know how your heart blood goes through your heart into your lungs, gives you oxygen, and then comes back out your heart for your body to have oxygenated blood. That main big artery was like that big. It was huge. And so then they had to do surgery, and during surgery they found 5 more. And after they found 5 more, we had to do a second surgery. The electrophysiologist brought up hereditary hemorrhagic telangiectasia to me, the genetic disorder. He said it's not common for people to have AVMs, arteriovenous malformations, which is what I had, and that one was ready to rupture in your lungs, especially multiple ones. you should get tested for the genetic disorder. So I did, and I have it. And I had no follow-up. The only follow-up he knew of, and the only follow-up any doctors around me knew of, was all the way at the Mayo Clinic, which is something I'm not financially capable of doing. I can't get there. So I just never followed up. And because when they corrected my pulmonary AVMs, after the 2 surgeries were done and I recovered, it took me about 6 or 7 months. But most of my dysautonomia symptoms went away. So I just never went back to cardiology. I never followed up with the POTS ever again. I just assumed that he was wrong because so many of my symptoms cleared up when they fixed the aneurysms, that it was due to the aneurysm in my lungs and all the AVMs, the other smaller AVMs, and not POTS. So I just have never followed up on that one. But I still have lingering dysautonomia symptoms. And then, but I was still, given all that, relatively active, more than relatively. I used to walk 17 miles a day. I would hike, I would bike, I would camp with my partner. We'd kayak and bike ride for miles. Plus, I worked full time, and I did yoga every day. I weight trained a couple times a week. I was very active. In 2015, I had my third psychotic break, and that lasted about 6 months. I dropped down to 90 pounds because I was afraid to eat. I did all sorts of crazy things, some of which I remember, some of which I don't. I nearly lost my housing, nearly lost my job, I nearly lost all my friends. I was in and out of all sorts of hospitals. I was certified. And that's when I knew it wasn't just like, one-off from stress, because people that are under extreme stress can have psychotic breaks, that this is part of my bipolar condition. I have been labeled bipolar 1, the most severe, depending on what you're talking about, the mania or the depression form of bipolar that you can have, because you can reach mania, you can reach psychosis, and I apparently have that capacity, because this was now the 3rd time I was in full-blown psychosis, and they debated diagnosing me schizophrenic because I didn't have a precipitating mood episode, but they decided to stick with bipolar with psychosis as my label, because unfortunately it is still more socially acceptable to be named bipolar even with psychosis, as opposed to having anything related to schizoaffective or schizophrenia on your diagnostic list, because the world is really misinformed. And around the same time, let's see, got a sleep disorder, got psychosis, what did I miss? I don't know. Right about the start of COVID, I got the worst illness I've had in my entire life. And for like a week, I had to crawl to get to the bathroom. I was so sick. I've never been so sick. We should have been in the hospital, but we were too sick to get ourselves there. I did eventually call 911. I didn't know what to do. Eventually got diagnosed with Epstein-Barr, and they said there was something else going on. They didn't know what it was. Could have been COVID. It was the start of COVID. There wasn't testing centers or anything back then. I kind of was delusionally sick, physically, for about 3 weeks, and the virus destroyed my body. It triggered RA, and long-standing RA. I was sick for, so exhausted. I never got well. I never got myself back. I ended up with, again, going to prevent losing my job, I took a month leave. I was still full-time at the time. I took a month leave to start seeking doctors. I was sent to rheumatology, immunology, and they diagnosed me with post-viral syndrome, became chronic fatigue syndrome. They found some problems, MTHFR gene mutation, um, and gave me supplements, and L-carnitine deficiency and gave me supplements, and um, iron anemia, which I've had repeatedly due to my excessive period, which they gave me infusions for, and everything they could do and should do, and they did everything they possibly could have done to make me feel better, and it didn't. I was a shell of myself. My energy was sucked. I was 50% at best of who I used to be. Um, and That's when my diagnosis after about 6 months, and no improvement was changed to ME/CFS. And they also found out that I had rheumatoid arthritis. It had been about a year and a half or so since I got sick when they diagnosed me with rheumatoid arthritis. And they finally, just in the last, God, that was like 3 years ago, just in the last month or two, got my RA numbers and the vector scores under control. And I'm still in excruciating pain. The rheumatoid arthritis triggered the central sensitization syndrome because my body was exposed to untreated rheumatoid arthritis pain day after day after day after day after day for nearly 2 years. That now the RA pain is gone, but the pain still remains, and that's where my central sensitization or fibromyalgia comes from. They decided to label me fibromyalgia as opposed to the other central sensitization disorders because I have a high ACEs score. ACEs is a test that they give that scores your childhood trauma, because it's now been scientifically proven that childhood trauma experiences not only lead to psychological problems, but actual manifestation of physical problems like coronary heart disease, dementia, heart attack, stroke, other risk factors. And they said because your ACEs score is so high, because I do have childhood trauma, that they were going to label me fibromyalgia because it was the most likely one. And in doing so, they have essentially blocked me from receiving adequate pain management because fibromyalgia is such a stigmatized disorder. I feel like I got traumatized for my trauma. I feel like, thanks, because you have experienced trauma in your past so severely, we're going to, so severely it can cause medical problems. We're going to label you with a stigmatized disorder that no one will provide you pain relief treatment for. Thank you very much. So that was about 2 years ago when I got the formal fibromyalgia diagnosis from rheumatology. And non-diabetic hypoglycemia, I've had that disorder for years and years and years. I've collapsed randomly and had to go to the ER and get ambulance and injections of glucose when I was too ill to have it orally. They have an oral solution where they just like squish it under your tongue and it absorbs through your mouth and raises your glucose. But I've been tested left, right, center, backward, and forward. I have diabetes in my family, a lot of it diabetes type 2 and diabetes type 1. But so far, I come back fine for diabetes, but I have had horrific, dangerous episodes of non-diabetic hypoglycemia, and that's been going on for years, since I was in adolescence. The tremors are, they have them listed on my diagnosis as resting tremors, which I'm not sure why. They made a boo-boo, I think. They are intention tremors. Like if I go to do something, the more detailed it is, the more my tremor goes off. It's mostly in my limbs, but it's called familial tremor. It does get worse with time. and I've had it as far back as my adolescence. Um, Not really a problem. It can be a little embarrassing. I've had people joke with me and tell me my grandpa shakes like that. He has Parkinson's. Or are you an alcoholic? You got the shakes in the morning. Oh, piss off. But that one, my mom now has vascular dementia, and I already have microhemorrhage bleeding and AVMs in my brain. And it's quite likely that it's a dominant genetic disorder, which means both parents have to have the gene for it, or only one parent needs to have the gene for it. There's so many medical problems on both sides of my family, I can't tell who I got hereditary hemorrhagic telangiectasia for, and nobody is willing to take the test. It could save their life, like it saved mine numerous times. Anyway, that's my family. But she has tremors now, really severe essential tremors will eventually make you one of those shaky old people who tries to eat the soup and you can't get the soup to your mouth because it tends to work its way up your arms, up into your shoulders, your neck, your voice box. So people head bomb a lot, or their voice might be really shaky. But it's not an at-rest tremor. At-rest tremors are more like Parkinson's. Um, so I'm grateful it's not an at-rest tremor, or I would be more concerned. So I need to make sure they correct that in my medical history, unless they know something I don't know. But yeah, I also have a microadenoma. No, it's meningioma. I have a meningioma that is a small tumor in my brain, in the lining of my brain. And the brain is like an egg. It's got, if you take the shell off, which is the skull, it's got a little skin coating around it, like eggs do. There's a tumor on that skin coating. They're usually benign, non-cancerous growths. They're usually slow growing. And I stopped going to the neurologist because the last time I went for an appointment, I had a new neurologist, and it was a new patient appointment, and he told me that I needed a better shrink, and I don't need a neurologist, and I should be glad I don't need a neurologist, and shut me out of neurology, despite my history of migraines and meningioma in my brain and other issues. And then 2 days later, I was diagnosed with the AVMs in my brain. So I need to get the medical neuropsych and neuro surgery stuff from the specialist back over to my old neurologist locally, so they will pick back up where they started, because I'm supposed to be getting biannual MRIs to make sure how that thing is growing, because it is the location is the problem. The size is not the problem. It's small. The location is the problem. It is near my carotid artery and my eye socket and stuff, and my pituitary gland. And so if it gets too big, it will put pressure on my vision, and potentially cut off my carotid artery, which can cause stroke and stuff, and they'll have to remove it. So I have to follow up on that as well. But not until after the hysterectomy thing. And I've talked about the hysterectomy thing, pre-cancer again. And so after they get all this done, they're going to go back and test some more genetic testing for things like Lynch syndrome or non-polyposis, colorectal cancer, or whatever, to see if I have a predisposition. Kind of clearly have a predisposition for lumps, bumps, and tumors. But I see if I have a disposition because of the precancer so young in my colon, and now precancer in my uterus. If I have a genetic disorder that sets me up for having cancers in various organs of my body. And I have to get back in touch with my local gastro and get back in touch with my local neuro. and reconvince them that I'm not insane. It's funny how many times, how many disorders, how many diagnoses do you need to have before they don't suddenly circle back to the fact that you're just insane and then just chop you off the clinic. It's really irritating. I'm diagnosed with so many things at this point medically, professionally, medically diagnosed, not self-diagnosis, medical diagnosis by professionals and specialists. I don't know if I missed any because I got too many, but that is my story of what I got and when I got it. Because people on here wonder, what illness does she have? The shorter answer is, which one do I not? Peace, love, joy.